Welcome back, deep divers. Ready for another medical mystery?
Always. What do we have today?
Today we're diving into something you probably haven't heard of. It's called Kikuchi disease.
Kikuchi, okay, I'm intrigued.
It's this rare condition, mainly affects the lymph nodes.
Lymph nodes, so like the immune system.
Exactly, and we've got a fascinating case study to dissect.
From?
A medical journal. And get this, the patient is a medical student.
Oh, wow, a medical student with a rare disease. That's,
Talk about being in the right place at the right time.
Yeah, definitely makes you think.
Absolutely. So, to give everyone a little background, Kikuchi disease, it's benign.
Benign meaning?
Not cancerous, and it usually goes away on its own. Self-limiting, doctors call it.
Interesting. So what happened with this medical student?
All right, so picture this. 24-year-old woman, she starts getting these swollen lymph nodes in her neck.
Okay, swollen lymph nodes, that's pretty common, right?
Right, but these had been bothering her for weeks. Firm and tender to the touch. 3 weeks, to be exact.
That's a bit longer than your typical swollen glands with a cold or something.
And, hold on, there's more.
Uh,
A few months before that, she had similar swelling, but behind her head, occipital lymphadenopathy, the report says.
Okay, so 2 separate instances of swollen lymph nodes. And she's a medical student. I bet she was starting to get a little concerned.
You bet. And to make things even more interesting, she had a history of exposure to cytomegalovirus.
CMV.
Yeah, CMV. They found a positive CMV IgG result, meaning she had been infected at some point.
Okay, starting to see a bit of a pattern here. So what did the doctors do?
They ordered a CT scan of her neck and chest, and that's when things got really interesting.
What did they find?
Well, first of all, let me just clarify something.
Sure.
Besides the swollen lymph nodes, the student was experiencing, get this, no other symptoms.
Really? No fever, no fatigue, nothing?
Nope. But back to that CT scan, it showed enlarged lymph nodes all over the place.
All over, like where?
Her armpits, above her collarbone, down her neck. And they even found one in her chest, in the anterior mediastinum.
Wow. So they're thinking lymphoma at this point, right?
I mean, it definitely looks suspicious, right?
Yeah.
So to figure out what was going on, they did an excisional biopsy.
Meaning?
They surgically removed one of the lymph nodes to examine it under a microscope.
Ah, that's the gold standard for diagnosing these kinds of things.
Exactly. And that's how they finally figured out it was Kikuchi disease.
So not lymphoma or anything else?
Nope, just Kikuchi.
It's amazing how this disease can mimic so many other conditions.
I know, right? And you mentioned earlier how Kikuchi can be easily misdiagnosed. Why is that?
Well, think about the symptoms we've talked about. Swollen lymph nodes, possible fever, fatigue. Those are all pretty general.
Yeah, I could see how that would be tricky.
It could be anything from a simple viral infection to something more serious like we thought, lymphoma.
Or even tuberculosis, right?
Exactly. And sometimes it can even look like lupus or other autoimmune disorders.
So what causes Kikuchi disease? Is it that cytomegalovirus we talked about earlier?
Well, that's the thing. We still don't know for sure.
What, seriously?
Yeah, it's still a bit of a medical mystery.
You're telling me a medical student gets diagnosed with a mysterious disease, and even with all the research and expertise out there, nobody knows what causes it?
Well, we have some ideas, but no definitive answers.
Like what?
Some researchers think it could be triggered by a virus.
Like the CMV.
Possibly. Or the Epstein-Barr virus. That's another common suspect.
The one that causes mono.
Exactly. But it's not as simple as you get the virus, you get Kikuchi. It's more like the virus might somehow trigger the disease in people who are already predisposed to it.
So it's not a direct cause and effect.
Right. And another theory is that it might be an autoimmune reaction.
Autoimmune. Meaning?
Meaning the body's immune system mistakenly attacks its own healthy tissues.
So a lot of maybes and could be's.
Exactly. And that's why it's so important to consider Kikuchi disease as a possibility when someone presents with these kinds of symptoms, especially in younger people.
So back to our medical student. What happened after they figured out it was Kikuchi?
Well, the doctors suggested treatment, as they usually do.
What kind of treatment?
Things like NSAIDs, like ibuprofen or naproxen to manage any pain or inflammation.
Okay, makes sense.
And they also considered a low dose of prednisolone, which is a corticosteroid.
Steroids, huh? That sounds serious.
They can be helpful for reducing inflammation, but they also come with potential side effects.
Right. So did the student take the treatments?
She actually decided to Decline them.
Wait, seriously, why would she do that?
Well, remember how we said Kikuchi is usually self-limiting?
Yeah, it tends to go away on its own.
Exactly. So in many cases, treatment is more about managing symptoms than actually curing the disease. And in her case, she wasn't really experiencing any severe symptoms.
But still, it seems risky, right? I mean, what if it didn't go away on its own?
Well, there's always that risk, and it's a decision that should be made in consultation with a doctor, weighing the potential benefits and risks. But in this case, the student, being a medical student herself, probably had a good understanding of the disease and felt comfortable with her decision.
And did it work out for her?
It did. A year later, she had a follow-up CT scan, and all the swollen lymph nodes were gone.
No kidding.
And get this, 10 years later, she was still healthy. No signs of any malignancies, autoimmune diseases, or even recurrence of Kikuchi.
Wow. Talk about a happy ending.
Right. It really highlights that while it can be a scary diagnosis, Kikuchi disease often resolves without any lasting problems.
So let me get this straight. This medical student got hit with a rare, mysterious disease that mimics a bunch of other scary conditions, and then she just decided to skip the treatment and hope for the best.
Well, it's important to remember she was a medical student, so she probably had more information than the average person about her condition.
That's true. And she was lucky it worked out for her.
Definitely. And it's not to say that everyone should just forgo treatment.
Right. It's always important to talk to your doctor and make an informed decision.
Absolutely. But this case does raise some interesting questions about the approach to treatment for a condition that often resolves on its own.
It really makes you think, right? Like, did her knowledge as a medical student play a role in her decision? Would she have made the same choice if she wasn't in the medical field?
Those are great questions.
It is pretty fascinating how much we still don't know about Kikuchi disease.
Absolutely. There's still so much to learn, and hopefully more research will shed light on the causes and better treatment options.
Well, deep divers, I think we've given you a lot to ponder today. If you're as intrigued by Kikuchi disease as we are, I encourage you to do your own research.
It's a fascinating condition, and who knows, maybe one of you listening will be the one to solve the mystery of what causes it.
And that's a wrap for today's deep dive. Until next time, stay curious.